I am the co-founder of Kickback, which is a youth development organisation responding to youth homelessness.
Amazing. And what brings you to HiNZ?
Yeah, so we've been here today with one of our partners, Massive Community Trust, talking about a project that we're a part of called the Safety Net Project, which is all about trying to provide a grassroots response to youth homelessness. Right now, there's this issue where, there's no really safe immediate accommodation for a young person. So, if they get kicked out of home, if they're unsafe, they ended up living on the street in many cases, or they're being shoved into a motel where they're often at great risk of harm. And so the safety net's really about partnering with local communities and building a kind of grassroots response to that. Utilising host homes, utilising whānau in the community. They're like, look, homelessness isn't acceptable to me. What can I do about it? And, open up their homes to care for these young people, which is really beautiful.
Yeah. That's so cool. And so that ties in, obviously, with the stuff that Kickback does. Tell me a little bit more about Kickback and, how that exists and how it's, and who it supports more, who it works with.
Yeah. So Kickback, look, we're a fairly new kind of trust. We started in probably beginning of 2023. Our journey began. I've been involved in kind of youth housing and homelessness space for a long time. And, we realised that there's some significant gaps still in the sector. And so my wife and I, summer in our whānau, we started Kickback because we wanted to do what we could to be part of this journey of ending homelessness for rangatahi in New Zealand. And so we've got three key aims. One is education, so supporting our sector to have a greater understanding of youth homelessness so we're better equipped to support them and care for them.
Yeah.
Advocacy, working at that systems change level, trying to ensure that, decision makers understand what's going on for our young people so we can actually have some core solutions to this so we don't have to just continue managing homelessness in Aotearoa, we can actually fix it. And innovation, we really focus on where are there gaps in the sector, where are some spaces where our young people aren't being served, and there needs to be some innovation and some thinking. And so we kind of focus on that and design models that hopefully can contribute to our collective mataranga to solve some of these challenges.
Oh, so cool. And so, what I've loved about Digital Health Week is just the different perspectives from around the world, really, but also different parts of the broader ecosystem. Homelessness, I imagine, healthcare plays an important part, but it's part of a bigger picture, a more societal impact. What brings you to specifically the healthcare component of this and how that ties into what you do?
Yeah, I think for a long time, homelessness sometimes gets kind of lumped into just a housing issue, and housing is definitely core to it, but alongside that is all these health needs, and so when we're serving a young person who's had experience of homelessness, there's also inequities around their access to healthcare, their access to mental health support, and challenges that are contributing to, I guess, the harm they're experiencing while they're experiencing homelessness as well. In terms of coming here today, we partner with Recordbase, who's client management system that helps us to kind of really get the data and ensure that we're actually visualizing the experiences of our young people. We're really, really focused on how do we create that wider systemic change for our rangatahi. And something we learned, and it was actually in 2020, there was this, some of you remember where you were in 2020 during the COVID lockdown, right? And you might remember those...
Working from my laundry, to be honest.
Yeah, well, so I was leading a youth housing service at the time, and we had you might remember those headlines. They were like, we've solved homelessness, right? And those went across the country. We've solved homelessness. Everyone was being put in motels, and a group that we missed out during that period were our young people. There were kids that were still sleeping rough during that period of time. They were being denied access to housing. And, I don't think that it was anyone's intention in Wellington to lock young people out of support and leave them on the street. But because their experiences, we haven't done enough to kind of really understand the data and gather the data. It means when people are making really quick decisions, we don't have the data to back it up and make sure that our most vulnerable groups are actually accounted for and resources are put in the right places to serve them. And so one of the things we're really focused on is ensuring that we are developing that data set, as we're serving our young people, we're also getting the data to enable us to give voice to the experiences of our young people so that when people are making decisions around where resources can go and what services we need and in crisis how we respond to that, we're able to visualize the experiences of our young people and give voice to that. And it's something that, Recordbase has been really helpful for us to kind of start to tell that story.
Yeah, isn't that interesting? Because I often think about, there's so much power in hearing an individual story and their experiences, and we need to be able to showcase some of those perspectives because often those voices aren't heard. But I've not thought about that, the enabling a community or a cohort of need their voice at scale, like through data, which can sometimes seem as, faceless, bit the binary information. But I guess if you've got that visibility on something that might be overlooked, and as you say, potentially through no intention, but just because it's not front of mind, if we can get that data, information, insights and trends, whatever it might be, into, I guess, in front of the people that are making decisions or at a policy level or something, that's got to be super important.
Yeah, and the stories are powerful, right? And they go so far. I think what we've learned is that, especially from an issue around youth homelessness, there's almost been a disbelief that this thing is actually going on, that there actually is a reality where you have, and this reality in New Zealand. We spoke to a 12-year-old this week, right, who's sleeping rough in our community. And that is the reality, that there are children sleeping on the streets in Auckland, around the country. There are young people as young as 16 who, you ask them, how long have you experienced homelessness? And they can never tell you that they've lived anywhere longer than 2 months, right? That's been their life. And so I think sometimes if you've not kind of been connected to these communities and to our young people's experiences, you think, man, that can't happen. Like, surely that's not happening in New Zealand. And so the story maybe, it reaches your heart, but is it bigger than that one person? Surely that's a mistake. This is where the data can really help us to say, well, yes, look, this is one story, but it's one of many. And so using those stories alongside some good information, some good data to actually start saying, well, we need a much wider systemic approach to what is a long-term structural issue.
Yeah, love this. And I love that you're able to share it with at least attendees here at Digital Health Week. What's the plan? How do you get this out to even the people that need to hear and see it and really drive the action that you're hoping to drive?
Yeah, I mean, if you're interested in our work, you can follow us at Kickback. We're on in our hashtags Kickback Makes Change. You can find us on Instagram, LinkedIn, wherever. If you're kind of concerned around the issue of homelessness and youth homelessness at the moment, we're part of a campaign that's calling on the government to bring about duty to assist legislation, which is basically legislation that just clarifies all of our roles in the society, which says actually if someone's experiencing homelessness, the state has a responsibility to support them, community has a responsibility to support them. And as a community, we also have a responsibility to work together. And, places like Europe and Wales, they have this legislation which ensures that actually if I don't know where you go tonight, I can turn up to either an agency or a government agency or a community agency and get connected to the support I need. And that doesn't happen in New Zealand. In New Zealand, a 16-year-old can turn up to, a government agency and be told, we can't support you, and left to sleep on the street. And that is happening fairly regularly. And so it's about clarifying our roles and ensuring that our responsibilities are held collectively.
Yeah.